The efforts of biologists to understand the role of the different hormones in the female menstrual cycle led to some of the most important advances in science. Women are now able to control their fertility and decide whether or not they want to become pregnant. Doctors and scientists are now able to create what are known as test tube babies and help women who'd previously been unable to have children because of problems in releasing an egg.
Follicle-stimulating hormone, or FSH for short, is produced by the pituitary gland. It leads to the eggs in the ovaries maturing. Biologists investigating how the hormone was controlled realized that they could make an oral contraceptive. Their idea was a pill containing estrogen. Estrogen is another hormone which causes the lining of the uterus to get thicker and inhibits FSH so that eggs no longer mature.
But interfering with the natural hormone balance in the body came at a price. It soon became clear that flooding the body with estrogen caused a number of side effects. Women taking an estrogen-only pill found that they put on weight, some became depressed and had increased salt and water retention. Blood clotting was increased, and some women had a problem with the thyroid hormone. Other symptoms included increased risk of cancer of the uterus lining and breast cancer.
Having established that it wasn't going to be as simple as using one hormone, biologists looked in more detail at how they could mimic the body's own method of controlling menstruation and ovulation. By drastically reducing the amount of estrogen and adding progesterone to the pill, the harmful effects of estrogen alone were reduced.
Progesterone is another hormone that causes FSH to be inhibited. If there's no FSH, the eggs don't mature. Combining estrogen and progesterone in the contraceptive pill gave better control of ovulation with fewer side effects.
This pill is still in use today and is known as the combined pill. It's 99% effective as long as the rules for taking it are followed. This means that it protects against pregnancy 99 times in 100. Of course, this also means that pregnancy may still occur 1 in every 100 times.
Progesterone turned out to be pretty good on its own as a contraceptive. Called the mini pill, progesterone-only pills are taken every day without any breaks. The mini pill doesn't control a woman's periods as the combined pill does, and is less effective at preventing pregnancy. It has a 98% success rate. However, it has even fewer side effects than the combined pill.
Women who can't naturally produce FSH in high enough levels for their eggs to mature would normally be infertile. Taking a pill containing FSH and luteinizing hormone enables the woman's eggs to mature and be released. This increases her chance of pregnancy.
Sometimes a woman's eggs can be collected for fertilization by sperm outside the body. This is called in vitro fertilization, or IVF. Once the embryo has reached a certain size, it's implanted into the uterus where, with luck, it develops into a healthy baby.